Stephen, it's fantastic to be here. It's had a great day today. Thanks for having me.
Thank you for coming up. It's been really, really good having you. Really good seeing you, catching up again.
Thank you very much. So tell everyone a bit about yourself and how you started Dental Effects off.
Well, for quite a few years, up until about 8 years ago, I was working in a mixed general practice. I had 2 partners. We had multiple associates, but more and more, my time has been taken up by doing implants and beginning to take referrals, and it kind of didn't work in the general practice scenario. So for a number of reasons, myself and my partner decided at the time for that business, was that the cycle of the business was right to sell.
Great.
So we sold the business. I worked a contract with the company for 3 years, 3.5 years, and then my goal was to set up Dental FX, which was basically a practice focused on delivering and providing implants and specialist referral services surrounding implants.
Right. Why implants? What's your special interest in implants?
Well, it kind of started off in 1990, so we're looking at 24.5 years ago, when a patient walked into my office back then with a missing tooth and said he wanted an implant. And I asked him why an implant, and he said he didn't want a bridge and he didn't want a denture. It was just one missing front tooth.
Yeah.
And he said, "That's what I want. Can you do it?" And I said, "Yeah, of course I can do it."
Yeah.
It was a complete lie, of course.
Right. Okay.
But back then I was in my early 20s, and I thought, well, you know, I'd heard a little bit about implants and didn't really know what they were.
Yeah.
So I found someone who could place that implant for this patient. In those days, we were leaving implants 4 to 6 months before being ready to restore. So I had a little bit of time to find a course and learn how to restore the implant. And that's how I started.
So a bit fake it till you make it.
A little bit.
Right, okay.
But that one patient, sort of, a light bulb went on in my head as a result of seeing him. And this one case led to 2 or 3 or 4 other cases over the next year, 18 months. Not that long. It wasn't that quick. And I saw implants as being the future. Yeah. And there were about 4 or 5 of us locally who were just starting in that field. So a couple had been doing it for a few years. Yeah. And we set up between us, we set up a local study group. Great. Where we meet once a month in the basements of our practices, because this was a dark art society. Sure. Yeah. We were the pariahs of dentistry. This didn't work, this was witchcraft. And I would have dentists coming up to me and saying, "Are you putting implants in people? I hear you putting these titanium implants into people." Yeah. I say yes, and they would finger wag me and say, "How can you do that to patients? Wow. It can't possibly work." Yeah. I thought at the time it was the future, and it has been borne out. Fantastic. So that's where it all began, and it's begun, and that was a journey that's now continued to this day. And the passion is still strong. It's grown. Absolutely. Yeah. Absolutely. So how many roughly do you place in a year then from that? We sort of plateaued in the last 3, 4, 5 years between 300 and 400. Wow. Which is, you know, it keeps us busy. Sure, sure. Okay. So Dental FX, what was the name behind the FX bit then? What was the reason behind the name? Well, it's also a good story. Yeah. And then you can identify with it a little bit, because when I bought this office, and it was a working dental practice, although it hadn't been developed. It'd been kitted out very nicely, but as a business it hadn't been developed. And it just was in the ideal position for us. So, and it was called Rosevale Dental Care, and I just thought that was nursing home stuff for me. Connotations of old people, not what we wanted to provide. So we really couldn't think of a name, and I had a design chap who still does some work for us on website development, that type of thing, and we threw about some names, and we really didn't know what. And I was travelling to a function in Prestbury, near where you live. Oh yeah, Cheshire, North West. And we were driving through Wimslow. Yeah. And I saw there was a shop called Beauty FX. Wow. And I said to my wife Lucy, I said, "What about Dental FX?" And she goes, "Actually, that sounds okay." Yeah. So I came back here, I suggested to my team, Susie included, "What about Dental FX?" And it was kind of, "Well, what does that mean?" I said, "Well, it can mean anything you want it to mean." Yeah. So, and that's what it was, and it's kind of stuck. Great. So this has been with you all those years? 8 years. 8 years, fantastic. So you took my programme, you came down to Manchester, was it about 5 years ago, or? No, longer. Longer than that? Longer. It would have been about six to seven
7
years
years
ago.
Yeah, so tell us a bit about the journey of how you got to find out about me and how you came on the programme and sort of why you came on the course.
Well, I don't know if you remember, but I first met you quite a few years before that at an implant conference that you were speaking at. And we were introduced by your good friend and someone who was a classmate of mine, Neil Sampson.
Yeah, yeah.
And he said, come and meet Ashley, but before you have a chat with him, I'm just going to have to tell you, you've got to do his course.
Yeah.
And I said, oh, why? And I think you told me a little bit about what you do. And I hadn't done any kind of training like that before, so I went back and I looked at your website and what you did, and kind of never bothered, because I didn't think it was the sort of stuff that would benefit us. Then it was 2008, mid-2008, when the storm clouds were gathering with the economy, and I'm thinking, high-end dentistry, we could be affected here, and what can we do to up our game, to improve what we do? And the obvious thing for me was lead conversion, was converting referred patients, patient inquiries to actual treatment. And we measured it in those days, and we still do, and we were quite good. It was quite high. I think we were in the high 70%. But I just figured if we get from 75%, let's say, to 85 or 90 or above, then that's a relatively easy way of increasing the amount of business traffic coming through our door. So that's when we looked at doing your course. And I was realistic enough to realise that it wasn't good enough for me to do the course. I had to bring my whole team down. So I don't know if you remember, we all came down to Manchester for a couple of days, and it was a revelation. And my only regret, I had a big regret having done it, and that was having not done it 3 or 4 years before, when I was first told to. But I know that's a common story in your business.
What was the revelation? You know, maybe people are watching this and they're thinking, I'm good at communication already, and why should I do this? What was the real revelation for you then?
I can tell you the train journey back, I was thinking after 2 days of pretty intensive stuff that you cover, that we'd all be just conked out. But it was the exact opposite. We were talking, we were discussing what we picked up from the course and how we could incorporate it into the practice and into the business, into what we do. And it's difficult to remember conversations from back then, but I think the key thing at the time, the most important thing we took out of that, was discussing money with patients, because we were poor at it, as I think many dentists are. And then having broached that subject with the patient, being able to handle their objections. The other thing, and we took lots of other stuff, but we quickly forgot it because we were focusing on 1 or 2 things that we picked up from the course. And I remember doing the course a second time, and it was probably only about a year later, with an implant year group that I teach, or we do every year. In that particular year group, we brought along to your course, and you covered the whole bit on day 2 about buying signals. And I thought to myself, I don't even remember covering that the first time. I know we did, but that's probably one of the reasons why people have to repeat the course, because when you do it for the first time, you take it's like it's overwhelming. You do bring in a lot, but you don't bring in everything. And then every subsequent time of repeating the course, I've brought more and more out of it.
Brilliant. How many times have you taken that? Was it 6 times?
6 or 7.
6, 7 times, have you? Yeah. So we've got this programme in November. We're going to the ethical sales and communication course for people who are looking to market and create more opportunities to do implants, and yourself and Bill Schaefer very kindly going to come back and share examples and share your experiences, help me deliver some of the programs. What can people who are thinking about taking the progress, what can they expect over the whole 2 days?
Well, dentists who get involved in implants spend a lot of time, not to mention money, on their training, and quite rightly so. And because it's a costly exercise to train yourself up in this new skill that is pretty much not taught at undergraduate level. If it is taught, it's very, very, to a very tiny degree. So, as I said, clinicians spend a lot of time and money in doing that, but the one thing we don't get any training on at undergraduate and beyond that is actually being able to present it to patients. And nothing's a better example than implants.
Mm.
And all the allied stuff associated with implant dentistry, bone grafting, sinus grafting, all the other stuff. And to give you a great example, I run a course on sinus bone augmentation, which is a very technical subject, it's a specific procedure, but we do it commonly. And I'm actually doing this course this Friday, Saturday with a colleague of mine, Philip Friel. And we've got 10 delegates on, and I'll open it up, and I know what's going to happen because I've been doing this course for 7 or 8 years myself. And these delegates will say, well, it's all very well us learning how to do sinus bone grafting, but none of my patients seem to want it. And my reply is, well, that's funny that, because we do 1, 2, 3 of these procedures a week. And I pretty much never have a patient refuse the procedure based on a concern about having it done. And I can tell you that, I say to them, I can tell you that my patients are no different to your patients. They're the same people.
People always say my area is different.
They do, but they realise it's not, because they very quickly realise that there's something in the language they're using and the way they're presenting it that is putting their patients off. And I can honestly say, it's a rarity for a patient to say, I don't want that treatment because I don't fancy the sinus augmentation, can you do it another way? So the programme we're doing in November with Bill is your 2-day programme with these added extras about how to present those specifics as part of presenting and selling implant dentistry. How to talk about bone materials, how to talk about sinuses, how to talk about implants, how to talk about complex treatment, but not in a complex way. And that's not taking away the important things that have to be mentioned, like all the patient's options, risks and complications, costs, everything that has to go into both informed and written consent, 2 things that are very different but each are very important, but whilst at the same time getting the patient to accept the treatment. Because if I truly believe, and I know Bill is the same, that if your patients are refusing this work on the basis they don't fancy the procedure, we're actually doing them a disservice. And it's a bit of a crime in some respects, because they are being denied the work they want and need to have done, all because of the way we're presenting.
So in effect, really what you're saying is they're missing out on significant benefits in their lives. People don't know what they don't know.
Yes, and their patients are too, as a consequence of that.
Okay. So if you've got 1 or 2 dentists who might be watching this video who are thinking about coming on the course, maybe sitting on their fence, what sort of advice would you give, or what would you suggest to them based on the fact that you've done this 6-7 times now?
I would say that if they've never done your course, your 2-day course before, then they're going to get everything that's involved in that, which has been life-changing for me and my career. And I have to be honest, in the way I relate to my family and my friends and my colleagues, because it does change a lot of the way you use language. So if they've done your 2-day course or not done your 2-day course, they're going to get a lot out of it. Plus they're going to get this implant element. They will see Bill and I present situations where they will instantly recognise themselves in a funny way, in a good way, in a bad way, but they will see things happening and say, yeah, I do that, and I didn't realise I was doing it. They will develop good habits and they'll lose some bad habits.
Great. Okay, listen, thanks for your time today. Really
appreciate it. Thank you for having us today.
No, it's been great. See you in November. Thank you.
See you in November.